Welcome back. Today, we're going to be discussing another female cancer, and that is uterine cancer, and how not to mistake the signs. Case in point, mother of two, Kelly Pendry, made headline news on BBC on March the 6th with a heartfelt appeal to women to take control of their own health and not ignore the warning signs that could point to more serious illness. In 2016, after her second pregnancy, she began experiencing heavy, persistent bleeding, coupled with debilitating abdominal pain. Her concerns were dismissed by her health professional as common post-pregnancy issues, when in fact she was suffering from uterine cancer, in particular an aggressive form. By the time she was correctly diagnosed in 2021, the disease had become terminal. All women are at risk for uterine cancer, with the most common form being endometrial cancer, which forms in the lining of the uterus. But the risk obviously increases with age. Most uterine cancers are found in women who are going through or have gone through menopause, which may explain Kelly's misdiagnosis, as she presented with the disease much earlier in life than anticipated. Predicting whether a woman will develop uterine cancer is not easy, but several factors may increase your chances. Some are: if you are older than 50, have obesity, take estrogen without progesterone, have had trouble getting pregnant, or have had fewer than 5 periods in a year before starting menopause. Another potential risk factor is taking tamoxifen, a drug used to prevent and treat certain types of breast cancer. Also, should you have close family members who have had uterine, colon, or ovarian cancer, best speak to your doctor. Common symptoms are usually vaginal discharge or abnormal bleeding, particularly after you have gone through menopause and between periods. These are symptoms that should not be ignored. Of course, these symptoms could be caused by something other than cancer, but do not ignore the signs. See a doctor right away. Uterine cancer may also cause other symptoms such as pain or pressure in the pelvis, especially when urinating or during sexual intercourse. Currently, surgery to remove the uterus is the main treatment for uterine cancer, but advanced cases may need radiation and chemotherapy, or a combination of all three. The good news is that technological advancements by way of drugs and medical procedures for treating these types of cancers are increasing. The bad news is, so are the costs. According to the American Institute of Cancer Research, cancer costs the world approximately $895 billion a year. Cancer Research UK further claims that the cost of cancer drugs is increasing by 10% per year. Alongside the drugs, the cost of diagnosis, radiation, chemotherapy, imaging, pathology, surgery, and end-of-life care are also rising exponentially. Sadly, medical health schemes are unlikely to carry the full financial burden of the medical bills should you be diagnosed with one of these cancers, which is why seeking alternative ways to fund treatment is a must. The easiest, most affordable way to ensure you are not left with a mountain of bills is to take out gap cover, in particular, female cancer cover. With premiums starting from a mere 135 Rand a month, the newly launched female cancer cover by Total Risk Administrators is a good option. Upon diagnosis, and once your claim has been lodged, you will be paid out a lump sum towards your treatment within 48 hours. Sadly, a cancer diagnosis not only comes with emotional, physical, and psychological consequences, but financial ones as well. Ladies, be adequately prepared. As we age, we have a higher risk of contracting one of these deadly female cancers, and dealing with a cancer diagnosis is stressful enough without the financial implications. Until next time, when we meet again.